Welcome back. This is ANN News. The financial challenges for African countries in acquiring COVID-19 vaccines are already enormous. Now, the ability of citizens to pay for their jabs is another concern. South Africa is already thinking of ways to ensure its citizens have access to the vaccines by working on a plan to subsidize the cost. Correspondent Yulisa Injamela has the details.
South Africa is racing to acquire vaccines to immunize 67% of the population. According to the Health Ministry, the intention is to create a herd immunity against the coronavirus at least by the end of the year. So far, the country has procured 1 million doses of a COVID-19 vaccine, a far cry from the ultimate goal. So, some leading medical aid schemes have now stepped in. Discovery Health is one of them. The private health scheme will subsidize about 30% of the population for coronavirus vaccination once the jabs become available.
The medical scheme funding by law is obliged to fund for vaccinations for medical scheme members. So that's somewhere around 7.1 million medical scheme members will then receive funding for vaccination as part of that mechanism. In addition to that, there's a cross-subsidization mechanism that means that medical schemes will match fund for an additional 7.1 million people in the broader public sector. So not only will medical schemes fund for 7.1 million medical scheme beneficiaries, but will also fund for 7.1 million public sector beneficiaries.
For each person who belongs to a medical aid scheme who is immunized, an uninsured person will also be covered. The medical aid schemes have committed to purchasing the vaccines for more than their standard price.
From a Discovery Health perspective and a broader medical scheme environment perspective, I think we recognize the need for us to act in social solidarity to help get everyone in South Africa vaccinated, or at least get everyone access to vaccines in South Africa. So we've collaborating with government, we're pooling resources and funding and pooling capabilities so that we've got the best shot at accelerating the procurement of vaccine for all South Africans.
At least one public health expert says with all this funding, the rollout strategy of the vaccines will be critical.
Medical schemes will cover a large portion of the costs. They've even offered to pay for the non-medical scheme members in South Africa. So people not covered by insurance will be donated funds in order to get access. So I think that the main issue really is what is the rollout strategy and how is that to be organized. But right now, it's fine making the funds available, but you've got to get access to doses. You've got to get agreements in place.
Despite the medical aid scheme's efforts, a section of the population will still need to be financially covered in terms of access to the vaccine. Government has established a vaccine acquisition task team to deal with the problem. The mandate of the task team is to assist the country in pulling together financial resources to fill the gap.